Hi everyone, I'm Odysseus B. Dennis, a physician assistant and Bachelor of Biomedical Science, University of Liberia. So today I'm going to be talking to you on hepatitis, inflammation of the liver. So you just stick around and let's go. So hepatitis is an inflammation of the liver. When we say inflammation, we are talking about pain, swelling of the liver in your abdomen. So hepatitis is a broad term. We have so many hepatitis. We have the alcohol hepatitis. We have hepatitis B, hepatitis A, E, hepatitis C, and we even have autoimmune hepatitis B. But for this video, we are going to be talking shortly only on alcohol hepatitis. So let's go. So alcohol hepatitis again is an inflammation or pain and swelling of the liver, sometimes liver enlargement. So this is as a result of a huge intake of alcohol on a daily basis. Now we want to talk about how do we know that a person is at risk of alcohol hepatitis. Not all those who consume alcohol is at risk. Alcohol is consumed but at regular basis and is normal. But those who are at risk, so let's discuss them. One is anyone who consumes alcohol on daily basis at more than 14 grams, 20 to 40 is at risk of high level of alcohol intoxication to the liver, causing hepatitis. That's one. Two, based on gender or sex, females are at high risk. And I know you will ask why. The reason is there's an enzyme called alcohol dehydrogenase. It is usually lower in females, and it works within the gastrointestinal system to reduce the absorption of alcohol to the liver. But due to the low level of that enzyme, alcohol is huge quantity absorbed to the liver, causing alcohol hepatitis. So this is the reason why female can be exposed. So at just a consumption of 20 grams to 40 grams of alcohol daily already exposes them to hepatitis from alcohol. Another predisposing factor or risk factor involve genetic factors, and this include another enzyme called the cytoplasmic enzyme. Deficiency of cytoplasmic enzymes, which also eliminates alcohol from the body. So a parent will have a deficiency of such enzyme and will pass it to the children. So whenever alcohol intake at high quantity is found within the parent and within the children, the siblings, they are highly exposed to intoxication and hepatitis because the alcohol level will not be limited due to the deficiency of cytoplasmic enzyme. That's the genetic factor. Other risk factors involve nutritional status, consuming diet of unsaturated fats exposes you to a big body we call obesity, very large huge body, you put on body, heavy body weight, fats will not be broken down. Example, common foods that we eat, those poultry, frozen foods, they are food that consist of unsaturated fats. There are other foods, other nutritions. But obesity exposes one to having high concentration of fats, which can cause cirrhosis. So how do we know as predisposing person I'm disposed? If I have a symptom or one has a symptom of hepatitis from alcohol, how do I know? So research have shown that at times it's asymptomatic, you won't see any symptoms. But between the ages 30s to 40s, symptoms tend to surface. So let's list few symptoms of alcohol hepatitis. Fatigue, you feel very tired. Sometimes fever, and you'll be testing for other conditions. You are not realizing you're going to test malaria, typhoid fever, and they are all not reactive, negative. You begin to wonder why. Abdominal pain at the right upper quadrant where the liver lies based on anatomy. So you start having, when it progresses, you start having symptoms of jaundice, yellow eyes, followed by a very big abdomen called ascites. Also, portal hypertension, veins of the liver distending through the abdominal region. You see them visible. Followed by swollen feet, generalized jaundice, yellowish of the skin, the eye. Now, how can we prevent alcohol hepatitis? And how can we also treat hepatitis from alcohol? So, we first look at this word called abstinence. Avoid alcohol. It's simple. 2, doctors will use chemotherapies, corticosteroids, and proper dieting or nutrition. Getting used to eating more fruits. Reduce oil intake, unsaturated fats. And if all of that will not work, the last option when the liver is damaged is liver transplant. Hey man, I guess you know no one is available to give the liver out so easily. That means you are at risk of death. Alcohol hepatitis is dangerous. Let us please prevent. Drop your question in the comment section. Like, comment, and share. Thanks for watching. We'll come up with the next video talking about hepatitis B virus. Thank you. Again, I'm Odysseus B. Dennis, a physician assistant and Bachelor of Biomedical Science. Please don't forget to follow my page.